Hello, everybody. Today, cortisol, the diva hormone, is still in the spotlight. And in this discussion, we will explore the causes of Cushing syndrome using a simple mnemonic ACTH or TACE. So, not wasting much time, let's get started. Alright, so here we'll discuss the causes of Cushing syndrome, and we will start with the most common one being a long term exposure to prolonged or high dose glucocorticoids such as prednisolone. Imagine diseases with autoimmune backgrounds such as vasculitis, giant cell arthritis, lupus, rheumatoid arthritis, among many other autoimmune diseases that may indicate the need for long term steroids. What happens is that the chronic exposure to these glucocorticoids suppresses the ACTH levels, and this can lead to adrenal cortex atrophy. In this particular situation, if the doctor wants to help, there is the need to taper the glucocorticoids very slowly as the adrenal glands will take time to recover. You would also notice that the ACTH levels are suppressed in exogenous consumption of glucocorticoids. On the left, we also see Cushing's disease. This is a type of Cushing syndrome in which a pituitary adenoma produces excessive ACTH that promotes the excessive synthesis of cortisol. This is the most common form of endogenous Cushing syndrome. So in this situation, we also see that ACTH is elevated, but also cortisol levels are also elevated. Now on the far right, we see ectopic release of ACTH. This is where ACTH producing tumors that is outside the usual origin of production. ACTH is supposed to be produced in the pituitary gland, but in this instance, there is a tumor in the lungs, which is the most common ones producing ACTH that is also able to stimulate the zona fasciculata of the adrenal cortex where there is production of cortisol. Other tumors may include thymus or mediastinal tumors as well as the pancreas. In this situation, we would also observe that the ACTH levels are elevated, but also cortisol is also elevated. This means that we would have to discriminate between ectopic release of ACTH and Cushing's disease, as in both cases, there is an increased ACTH with an elevated cortisol levels. Now, in the adrenal gland itself, there may be an adenoma or a hyperplasia of one of the glands or both glands, or even a carcinoma that is producing cortisol from the adrenal glands. So in this case, there is an autonomous tumor production of cortisol. This will lead to a suppression of ACTH in this case. So these are the four causes of Cushing syndrome. Investigations of Cushing syndrome. You want to confirm Cushing syndrome, so you assess cortisol levels. You can use any of these tests: 24-hour urine-free cortisol, a low-dose dexamethasone overnight suppression test, late-night blood or saliva cortisol levels. One of the ways an exams can trick you into answering the question wrong is by saying that you have a patient that is on phenytoin or carbamazepine or rifampicin, and this patient has to undergo a test to assess or confirm Cushing syndrome. So if this patient would use dexamethasone overnight suppression test, you have to understand that rifampicin is a cytochrome inducer. It induces the cytochrome enzyme, if you do recall. All right. So once this enzyme is induced, then what will happen is that there is going to be an increase in the hepatic clearance of dexamethasone. So there wouldn't be enough dexamethasone to suppress the test, which will make this test a false positive one. Phenytoin will do the same thing. Carbamazepine will do the same thing. All right. Another way you can be tricked is, say, a patient with a liver failure or a patient taking itraconazole. This is rather an inhibitor of this enzyme. And so once you inhibit this enzyme, what will happen is that you reduce the hepatic clearance of dexamethasone, which will then lead to a false negative test. So in such cases, it would be recommended to do the 24-hour urine-free cortisol or late-night blood or saliva cortisol levels. So once the elevated cortisol levels have been established, it is now time to proceed to confirm the exact cause by assessing the ACTH levels. So once Cushing syndrome is confirmed by assessing the cortisol levels, which will be elevated, we will then proceed to assess the ACTH plasma levels. This will tell us the exact cause of Cushing syndrome. If ACTH levels are low, we can conclude that the disorder or pathology is in the adrenal gland. There is a tumor in the adrenal gland that is making cortisol. ACTH has nothing to do with that. ACTH production is still normal from the pituitary gland, and so ACTH will suppress normally if there is an increased cortisol production from the adrenal gland. This is an autonomous release of cortisol. ACTH should normally suppress. A patient that is also ingesting excessive glucocorticoids would also have a suppressed ACTH. In such cases, with a tumor in the adrenal gland, a very good imaging modality would be a CT scan. Next, if ACTH levels are high, then we are probably dealing with Cushing's disease or we are dealing with an ectopic ACTH release. How do we find that? We will proceed to do a high dose dexamethasone suppression test by using, say, 8 milligrams dexamethasone suppression test. It's important to note that ectopic release would have no response while Cushing's disease would respond. In Cushing's disease, you would like to do an MRI, which has a better sensitivity to find the small adenoma that is producing excessive ACTH. In ectopic release, you would like to use the CT scan to find the tumor or the carcinoma that is producing ACTH. Petrosal venous sampling may also be used as it drains the pituitary gland. Treatment of Cushing syndrome. In Cushing's disease, a transsphenoidal approach can be used to resect the adenoma from the pituitary gland. In ectopic ACTH release, surgery is necessary if there is no metastasis. Adrenal adenoma also needs an adrenalectomy, but in adrenal cancers, surgery rarely cures the disease. Radiotherapy and adrenolitics drugs such as mitotane may be used in adrenal cancers. Among medications that block cortisol may also include ketoconazole, mitorepan, and etomidate. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.